Well, Vickie, it's been very close to 5 years since you
Amazing.
arrived at Eastern Health. Has that seemed like a short 5 years or a fast 5 years?
Oh my gosh, it's a blink of an eye. I can't believe it's gone. That's what everybody says, like, how long have you been here now? And I'll say 5 years. Really? It just seems like it was yesterday. Yeah.
Now, you obviously knew a fair bit about Eastern Health before your arrival. I'm sure you had done your research, and of course we had been in the news a fair bit around that time.
Yeah.
But I'm curious as to what was your biggest surprise once you had fully taken the reins?
Well, I shouldn't have been as surprised as I was, but when I walked in here and met the people and saw the absolutely great work that was going on, we always hear the negative, and certainly Eastern Health had been through a really rough patch, and the patients here had had a tough time with the ERPR issue, and that's really what defined Eastern Health. Now, I knew that there were good things happening, but the breadth and depth and the strength of what was happening here that was so positive was a wonderful new surprise, and something that made me feel really good about coming.
Looking back, what was your biggest challenge externally?
I think it was, on a professional level, I think it was just being able to get people to talk about Eastern Health and to focus on everything that we are and not the failings that we had. So that really was what the board said. We want you to be doing that. We want you to spend your time not putting a spin on it, but just getting both sides of the story out, resolving what was the ERPR issues and the long-standing lawsuit that was there, being able to close the book on the chapter and then say, we're not trying to rewrite the book, we're still going to always remember that, but there's more chapters to be written, and start writing them. So I think that was really the biggest challenge that I had externally. Now, mind you, people were very welcoming and embraced that, and I think as much as that was the job I was given, people were ready for it to happen.
And of course, the other side of the coin, what was your biggest challenge internally?
I think, I don't want to harp on ERPR, but really the whole organization was bruised and battered. I don't think there was any area inside the organization not affected by what had happened. People's lives lost and people's lives affected, and families and staff members who had family members, and staff who were involved in the testing, and just that whole emotional upheaval of having something go badly, and so publicly go badly, and then having to recover from it. And so even today, talking about how many years later, we're a good 8 years after we started dealing with ERPR, and you can still see some of the signs of, somebody said post-traumatic stress. There'll be an issue and everybody holds their breath and says, oh, is this another ERPR, or is it? And that sort of reaction internally can hold people back from being the best they can be. So I think internally we had to say to folks, yes, we were there. Yes, we've come through it. You're very good at what you do. Don't have a lot of self-doubt. Let's get that confidence built and restored. So I think same thing internally.
You're really covering the country as a CEO. Of course, you served in Ontario and then here in the Far East, and now you're headed west. I think there's a tendency sometimes among people to think that the things that happen at Eastern Health are really unique. But in your experience and from your perspective, are there issues that are common throughout the whole country?
Oh, absolutely. And when you think about the big issues that we face, the issue around access and emergency wait times and long-term care beds and community support services, that's an Eastern Health story. That's a health story. That is exactly what we're looking at right across the country. So a very changing demographic, everybody getting older, needing more service. We don't have a lot of the infrastructure in place that we need as a nation to be ready for this kind of influx of people with my color hair. And so we're all struggling with it. And how do we make the current system expandable? How do we stretch that elastic without breaking it? And so everybody's doing that. And when you look at some of the big issues we've had, so ERPR, lab testing, we see lab testing results gone awry in Quebec, in New Brunswick, in BC. We see radiology testing problems in Ontario, in Manitoba, in Alberta. So it's not like there's any part of the healthcare system, I think, that can stand up and say, we're perfect. And we've all got the same issues. But it'll also, I think, be the same opportunities, which is wonderful people, because people in healthcare, whether you're in Newfoundland or BC, you are attracted to healthcare because you want to make a difference and you want to help somebody. And Newfoundlanders and Labradorians are phenomenal at doing that every day, and they're great at doing it inside Eastern Health.
What did you most want to accomplish here at Eastern Health, and have you done it?
So I wanted to be able to give face to the organization. So, you know, you talk about Eastern Health and it's easy to think about bricks and mortar, and you can be very disdainful of a building or an organization that's sort of nameless and faceless, you know. So I really wanted to personalize it a bit. So I wanted people, when they thought about Eastern Health, to know a face, to know a name. And I think that's been accomplished. I mean, I very often, when I'm out in the grocery store or at church, somebody will tap me on the shoulder and say, "You're the Mrs. from Eastern Health." So they know that there's a connection. So there was that, but I also wanted to be able to raise the level of confidence by demonstrating to everybody what great things happened here. And so when I got here and saw them all, it was, how do we proclaim that word? How do we get it out to everybody? So I think we've partially done that. I think there's still lots of work to do, and it's really easy to listen to the radio or pick up the newspaper and see, you know, the one or two things that didn't go well with somebody, and it's not so easy to find the really good news stories. So we all have to start shouting those out. We have to be able to tell the story of Eastern Health about who we are, what we do, and when things don't go well, say that too. So that was another thing I wanted to accomplish, was just that openness and transparency. I didn't want people to think we were going to hide either the good or the bad.
What will you miss most about your time here?
You know, I said this is one of the hardest places to leave. It's the people are wonderful. Somebody said to me, "You can't like the weather." I said, "God, I even love the weather." There's something comforting about rain, drizzle, and fog. I don't know. So I'm going to miss the whole thing, and so much so that Brian and I have decided we're going to retire here.
Really?
So we're out looking at a condo right now, or will be soon. And in 3 years' time, when my time's up in Alberta, we're going to come back here. And we've said to all of the kids, you know, come here. We're not going to retire in Ontario. We're coming back here. So,
what knowledge or experience that you've gained here at Eastern Health will you take with you now for future reference?
I think very much the need to be in front of an issue. I think that's, you know, sometimes we hear about a situation inside healthcare and you think, well, that's not such a big deal and we can do this. And if you're not out in front of it, if you're not able to say to people, this is what's happened, then it always sounds like you're making an excuse or that you're being defensive. And trying to explain a situation after it's happened, a long time after it's happened, if you haven't brought it out, then it does look very defensive. So that was a good lesson learned, that even small things need to be talked about. And we need to put it out in front of the staff and in front of the public and say, here's what we're doing, here's what happened, here's what we're doing differently, here's how you can be assured it's going to work. So.
What would be your advice to the incoming CEO?
I haven't met a Newfoundlander or Labradorian who hasn't started a conversation, something to the effect of, who are you people and where are you from? And people look for those connections. I mean, they're looking to connect with you on a level that's I've not seen anywhere else. It's a personal level. They really want to feel like they know you. And so I would say to whoever's coming in, make sure you're comfortable with that. Make sure you want to be embraced by a community, because you're going to be. And that comes with, you know, a whole bunch of things. You can't be anonymous here. If you're the CEO of Eastern Health, people know who you are. So I think you have to be ready for that. And for staff, you have to be able to be in touch with staff right across the province, right across our Eastern Health District, and be able to connect on some level. So the biggest piece for me will be somebody who's comfortable in who they are, knowledgeable about what they do, and able to embrace a whole bunch of people, because they're just waiting. I've told the stories. I go to the grocery store, and I never go to the grocery store without my lipstick on and my hair combed, because I'm going to get stopped by 5 or 6 people to tell me about an experience they or someone in their family has had with Eastern Health. Sometimes not so positive, but most often really positive. And they want me to know that there's good things happening. So it's good.
Any final words to staff?
I'm going to miss them. I've worked alongside a lot of really good people, and I know that I'm leaving the organization in really good hands. You know, that when you think about who's working here and the work they're doing, I have no doubt that they are doing absolutely wonderful things. So to all the staff, keep doing it. Support the person who's coming in behind me, because we'll just keep going forward. And make sure there's a bed for me somewhere when I come back, because as I get older in Newfoundland and Labrador, I'm going to need it.
How about final words to those we serve?
So to the public, I think, you know, focus a bit more on the positive experiences. I had a gentleman say to me very early on in my tenure, he actually wrote me in an email, and he said, "You have to get the good news stories out." He said, "I live here and I depend on Eastern Health for care. And if all I think that's going to happen there are bad things, I'm not going to feel so good when I have to come to emerge and look for care." So he said, "How are you going to convince me to trust the care I'm getting if we don't hear that good news, the positive things?" And so I think for the general public, yes, there are times when things don't go well, but they are few and far between, and they are opportunities for us to change how we do things and to learn from it. But by and large, we do the right things, the right way, for the right reasons, with the right outcomes. And I want people in Newfoundland and Labrador to take comfort in that, and to depend on it, and to trust that that's what they're going to get.
Well, thank you for your time today.
Oh, thank you, Deborah.
And thank you for the last 5 years, and all the best in your future endeavors. And we'll probably see you again.
I look forward to coming back.
All right, terrific, thanks.
Thanks.